Okay, now we're going to demonstrate how to do a 3-layer dressing, and we're going to assume that the doctor ordered an Una boot. They may have ordered alginate or foam, so you put your basic dressing on first. Now, the nice thing about the 3-layer dressings is they'll be labeled, so if you're not sure which layer, because you don't do them that often, it tells you. Okay, layer number 1 is usually just to kind of cover up, soak up drainage. It does not have to be tight. You can wrap it very loose. Again, you start it right under the toes. And you do wrap the heels. Patients love to have their heels unwrapped. It's really better to wrap them when you can. Sometimes you'll get a little bit of a give there, but we'll pick that up when we get the other layers on. And you just do a spiral all the way up. And the nice thing is if you do have an Una boot, once you get the first layer up, you don't have to worry about getting all that stuff on your clothes and arms and everything else. And then these you can just tear off. It makes it easy. All right, now this is the compression part of our wrap. And I don't know if you'll be able to see this, but on this ACE wrap, there are rectangles. And how you know when you've got enough compression is when you're pulling, the rectangles will turn into squares. And if you go way far and they look like rectangles again, you've gone too far and you're going to have the patient's leg coming right off. All right, so we start down here at the bottom. Now, to do the wrap around, you don't have to pull it real tight, just enough to get it started. And we're going to do a figure 8 on this. So you go around twice to get it there, to get it secure, and then we're going to start a figure 8. We're going to go up. When we're doing it, we're going up enough, and you might want to get in closer so they can see, so that we're making these rectangles into squares. And as we get them into squares, that way we know we've gotten enough compression. And then you just go up the leg with it. And sometimes if you haven't done a figure 8, you might want to practice. I haven't done them in a while, so you can see I'm even having a little trouble. But and it's not as easy for the patient to take these off as it is like a dressing with a spiral. And trust me, these 3- and 4-layer dressings, they will want to take off. If you've ever worn one yourself, which I had to do one day, we were seeing what it felt like. It's not great even when you have a healthy leg. And you will again, you never go back down on these. Once you get to the top, if you've got leftover, you cut it off. We never want to go back down a leg once we get to the top of it. All right, so this is the compression wrap. When you get to the top, you can wrap it around to secure it if you need to, and then we cut it off. Now, normally what I do is if I have a piece of tape, I put a piece of tape there, or I have the patient hold it. We're going to put the last layer on, which is the Coban. When you apply Coban, Coban can be very tight in itself, even if you don't have a compression. So when I apply Coban, I like to pull a little bit out, and then as I wrap, you don't want to wrap it so tight that when you're wrapping it, you pull it all the way and then put it on, unless the doctor has specifically told you that. That way, if their leg swells and you've got it that tight, they're going to want to take it off. It's going to be so tight, there's nowhere for the swelling to go. So you can pull it off enough to get it enough so that you can pull on it, and then just a gentle wrap around, and again, covering the heel. Pull it enough so that you know you've got it, and then let it slack a little bit. Now, you don't want it so loose that you can see pieces coming off, but just a nice, comfortable fit. And then sometimes you can use your body parts to help do it a little quicker. And I do tell them, again, they have to check their toes, be able to wiggle them. If they turn blue, if they feel numb, they need to call. And like I said, sometimes the doctors tell them they can cut a little bit up at the top if it gets too tight. That's up to the doctor and you and what you're comfortable with. Again, I rather just have them call me. And then if it's your policy, you can label the date that you did the dressing on this. And sometimes they don't stick real good either. You might want to put a piece of tape on them. But that is basically it. Thank you for your attention.